I get asked frequently about what do you do in your post-operative protocols. It's interesting, what I do in the actual surgery, let's talk about anterior cervical discectomy fusion. It's exactly the same operation, whether it's done in a hospital or an ASC. They're not hard to do in either center. There's a limited number of tools, parts and pieces. The staff are equivalent, the ORs are equivalent. So what's really different about outpatient, ACDF, and inpatient? It's one thing. What are you going to do with the patient when you finish the operation? In a hospital, you put them up on the ward, they stay up there, they're monitored, the nurse has 7 other patients, they get a little care, and they go home the next day. They're watching for one thing, post-operative bleed in the airway. That is all anyone is worried about that first night. So what's different about going home? You get a one-on-one, you get a spouse or a family member to partner with you in the center that's going to be responsible. You have a home nurse that visits, you have a physician's assistant that calls, and you keep a high level of acuity. You apply post-operative PI, pressure, ice, elevation. Age-old treatment of wounds and bleeding, and prevent any bleeding. And then the patient is safe, the patients are much more comfortable at home, and they're getting better care. They're getting more comfortable care, and they're not at risk for infection in a hospital-based setting. They don't go through the bureaucracy of getting 4 to 6 hours of discharge time. They go home, and they're much more comfortable. When we see them in the office the next morning, take out a drain, check the wound, check for everything they're interested in. Patients are getting more care from the doctor, not less care. In rounds, I'll make rounds of the hospital. I may have a couple minutes to see a patient. In my office, an hour. And so I think we actually enhance the quality, enhance the experience by doing these patients post-operatively with a protocol that creates safety, and safety is paramount. It's not about the procedure. The procedure is a simple outpatient procedure, inpatient or outpatient. It's about what you do after the procedure that makes all the difference.